Good evening. My name is Robin McGrady. Welcome to my YouTube channel. Today we're going to be talking about tissue expanders, and I want to talk about the pain, the process, and the complications. I want to do a disclaimer here and say that this is my personal experience with tissue expanders, and I'm not coming from a clinician's. Even though I am a nurse, I'm not coming in the place of a plastic surgeon, but I do have something to say, and I have something to say particularly to women of color, because while women, or black women, but women of color, are diagnosed less frequently than our European sisters, we die more of breast cancer than our European sisters. So while this video is not about that, that's another subject. What I do want to talk about is what a tissue expander is and the complications in black women, and what my personal experience is with that, and what you can do differently than I did so you can have a better outcome. Number one, a tissue expander is like a balloon-like device with a port, a metal port. Excuse me. And this metal port is magnetic, and the plastic surgeon or nurse practitioner will fill this with so many cc's every week or two, depending upon how your total treatment is going, and to expand the tissue. Now, when I woke up from surgery having a left breast mastectomy, the surgeon filled my breast with 500 cc's. Now, let me just say that 500 cc's is a lot of saline to put in. However, at that time, my breast size was much bigger than I am now, and so I imagine, that's why he did that. So for me, it was very, very painful, more painful within the first 24 hours when I left the hospital. I woke up and took one Percocet, and it didn't touch the pain. It didn't touch the pain. So you gotta go in educated and know that it hurts. Shortly thereafter, at that time when I had the pain, I called my surgeon, not the plastic surgeon, but I called my general surgeon, and she said, take another Percocet. I did, and the pain subsided. However, in the weeks and the months to follow, I would get an infection, number one, very large pigmentation on the skin. It looked horrible, family. Now, this hyperpigmentation is what I want to mention, because hyperpigmentation, poor healing, and keloids are a problem in African American women. A keloid is a raised area when someone has a cut or a surgical procedure, and it heals with a raised area and becomes hard. And if you have that in your history or in your family history, please notify the surgeon, because this is going to affect how you heal. Number two, I want to go back to the pain management again. You can ask for cancer rehabilitation, which some women don't ask for. I didn't know anything about it. I want you to know. And you can have physical therapy, do stretching, exercises. They will tell you how to do these exercises. In fact, there's another lady, I don't know her name, but I'm going to recommend her video, because she teaches very, very well about stretching, her experience, and how these exercises can help mitigate some of the pain. You want to go in armed, family. Knowledge is power, excuse me. Now, the next thing I want to mention is asking your plastic surgeon, is he culturally competent? Again, does he have before and after pictures? Is he familiar with the outcomes and the data as it relates to African American women and how they heal? Because if you have the big three, which I have, diabetes, hypertension, and obesity, then you are at risk for poor healing. Now, let me put that into context. If you have to get the information and contextualize it so that I don't want you to misunderstand what I'm saying. I have diabetes, which is controlled. I have hypertension, which is controlled. In other words, my blood pressure runs 120/60. My hemoglobin A1C is under 6. Try to keep it around 5.2. That's hard, I know. But in other words, these parameters all play a part in your healing process, because what you need to understand is that once this expander is placed, it needs the blood supply to the tissue in order to heal, in order that when you go back, if you choose to have a implant placed, then this has a chance to heal properly. And if you do not have that blood supply, then you're going to have complications. What are complications? Redness, infection, purulent drainage. When I say purulent drainage, I mean yellow or green leaking at the site. Bacteria, that it can be an infection there. And this is not good, because if this happens, the surgeon has to remove the implant. However, this does not mean that you cannot have another expander placed. You would have to talk this over with your surgeon and get an understanding, because this is not the end all be all. And a lot of sisters do not go back and get an implant, or for various reasons. And that's, again, is a very personal choice. But I want you to be armed with the information, knowledge. Knowledge is power, so you can make an educated decision. Again, does the plastic surgeon have you, how many surgeries have you done on black women? Are you familiar with this hyperpigmentation, of the skin? Are you have you spoken with the other team members? He will appreciate you talking to him, because this is going to help him do his job. Have your pen and paper ready. You can even ask to record the conversation. He will be respectful of that request, because then you can go back and listen and ask someone in the community or close to you, hey, do you know anyone that I can talk to? Whether this is on I have breast cancer baddies on Facebook. I put down some links in the bottom of this video that you can start talking, because one of the problems with African American women that I don't see in the European population is that we don't come together enough and talk about these things. And a lot of these negative outcomes could be prevented if we had the proper information, if there was not this culture of silence. Yeah, I'm going to leave that alone. That's another video. Let's break the culture of silence. We got to talk, family, because too many women are dying, being, disparities, racism. It is what it is, family. And we're better together. We're better together. So again, please talk to the surgeon. Tell them, hey, I didn't understand what you said. What do you mean by that? What are my options? This is the beauty of this. You got options. But if you don't know them, then you don't know them. So that's my job. Come back and see me, family. This is the end of this video. I love you. Peace to the family. God bless.